Hello guys, this is Sonu, and today I will discuss about the second beta-lactam antibiotic group, that is the cephalosporin. In previous time I discussed about the penicillin. So next part is the cephalosporin. As I said that in a beta-lactam we have four types of antibiotic, four group of the antibiotic, that is the penicillin, cephalosporin, monobactam and carbapenem. So penicillin already I discussed. Today we'll discuss about the cephalosporin. And one thing I also want to say about the cephalosporin, this is the most popular antibiotic all over the world. Means whenever the bacterial disease will occur in any patient, doctor always think about the cephalosporin first. If the cephalosporin will contraindication, if we allergy, then we'll move some other antibiotic. But always we'll try to give first cephalosporin. So what is the cephalosporin? It is a semi-synthetic antibiotic derived from the fungus like the in a penicillin. That is the fungus, the cephalosporinum, or now we can say that is the acromonium. So this is the fungus name, and cephalosporin is the further divided into fourth generation, first, second, and third and fourth. In some book is written the fifth generation also, but usually we use third generation most probably. But we have to study about the all generation. So let's talk about, today we'll discuss about the first generation. We'll discuss individually first, second, third and fourth. So in the first generation we have two types of classification, parentally and orally. Parentally means just we can give intramuscular and intravenous. We cannot give the orally. Why? Because due to bad absorption. In the orally we can give orally. So in the parentally we have cefazolin, just one drug. And one thing also I will mention that cephalosporin group the all drug name till first to fourth or fifth. Usually most probably they started from the C. So we can suspect that if the starting from C, Cepha, usually the drug name is CEF is the common name. So easy to remember the drug classification, that this drug always belong to the cephalosporin. That one thing also important to memorize the drug or classification. So in apparently we have cefazolin, orally cephalexin and cefadroxil. That is the three drugs which belong to the first generation. Let's move on that how this drug will, what is the mechanism and some other characteristics. Okay, this drug is the similar like structurally similar like the penicillin, and this drug also is the bactericidal. Bactericidal means it's a kill the bacteria like the penicillin, and also it's a, don't forget about the beta-lactam. Why beta-lactam? Because in the penicillin you can see this is the structure of the penicillin. This is the beta-lactam ring, but in a cephalosporin that is the all completely benzene ring. This is the just little change in the structurally. That is the cephalosporin structurally. So beta-lactam is the always there. Means if the beta-lactam will destroy to any region, obviously drug will not efficacy, drug will not work properly. Okay, let's move on the first of all pharmacokinetic. As I said, this drug we can give intravenous or intramuscular, and this two drug we can give orally. About the mechanism, almost the same like the penicillin. In a therapeutic dose, in a normal dose, whatever dose you giving, therapeutic dose, it will not penetrate the blood-brain barrier. Placental barrier can be penetrated, but it will not harmful for the children, and even it will come in the breast milk, so it will also not harmful too much in a therapeutic dose. But if more than higher dose, we can say more than therapeutic dose or very high dose, so it can be cross the blood-brain barrier, and some sickness side effect can be occur. But it always in a higher dose and very rare conditions. About the excretion method, the same like the penicillin, it's excreted by the tubular excretion, very fastly excretion, and can be it's inhibited by the probenocid, the same like in the penicillin. So about the pharmacokinetic, let's talk about pharmacokinetic. Intramuscular, intravenous for the parentally cefazolin, orally for this two drug for the orally. Okay, about the blood-brain barrier penetration in a normal dose, or we can say therapeutic dose. Therapeutic dose, not penetrate, not penetrate blood-brain barrier, or we can say poor penetration, very very poor penetration. But placental barrier can be, but it's not harmful. Same like the penicillin. About the metabolism and the excretion. Metabolism is the very fastly, and it's usually excreted by the tubular excretion. Tubular excretion. But one drug, that is the probanoside. Probanoside. Probanoside is the anti-gout drug. It's a drug for the hyperuricemia, if you increase the uric acid. But if you giving the same the both drug in the same time, so what will happen? This drug will be inhibit the metabolism of the cephalosporin, and it can lead to what? It can lead to some side effect can be occur, because it will not metabolize and it will present in the body. So obviously it will create the side effects. Then next thing, it's all the same like the penicillin, because the penicillin have the same problem. This penicillin also can be inhibit the metabolism by the probanoside, so the almost the same. Okay, next is the which types of bacteria is the sensitive. One thing also, that cephalosporin have disulfiram like action. That is a very very important thing. It has disulfiram like action. Okay, so what is the disulfiram action? Actually, this action is not in all generation. Some of the generation, like the first generation, have disulfiram like action. So what is the disulfiram action? In the disulfiram action, it is the whenever the person is drinking alcohol, and along with they're taking cephalosporin or disulfiram, it is also drug. It's a anti-alcoholic drug, we can say. Those person who has a very addiction of the alcohol, but they want to leave the drinking habit. On the time, disulfiram can be given. And what will do the disulfiram? Actually, whenever a person will take alcohol, it will go in a liver, and in liver it's convert to the acetaldehyde. And then acetaldehyde will further convert to the acetic acid, and then acetyl coenzyme, and so on and so on. But it's converted by the help of aldehyde dehydrogenase. Aldehyde dehydrogenase. This is the normal metabolism of the alcohol, but disulfiram will inhibit this enzyme, and due to inhibition of this enzyme, the concentration of the acetaldehyde become very very high. And what will happen? It will create the hangover, some tremor, some CNS defect, hallucinations, and some all type delirium, excitement, like all CNS side effects can be occur. The same like some drug, that is also one of the drug, the cephalosporin first generation. This drug also doing the same like disulfiram action. So those person who's taking alcohol, and along with the alcohol, if they take the in any one of this top drug, disulfiram action can be occur. Like they have vomiting, they have nausea, they have some CNS effect, hallucinations, like effect can be occur. That's why before giving the patient, we should inform to the patient that don't drink alcohol whenever you're using the antibiotic. Some other drug like metronidazole and some lot of drug is the disulfiram like action. That's why it's a very important thing. Even some question asks that any like the in group of the antibiotic, if in giving the options that which of the group of antibiotic have disulfiram action. So of course the cephalosporin will be there, so you can choose the correct answer, that is the cephalosporin. Okay, about the mechanism of the action. Mechanism of the action is the same like the penicillin. It also the bind the penicillin binding protein and inhibit the transpeptidase enzyme, and due to inhibition of the or interruption of the transpeptidase enzyme, the cell wall cannot be stay in the bacterial in a surrounding area, so bacteria will die, it will destroy because the hyperosmotic, it will burst and bacteria will die. So it's the same like almost same, we can say absolutely same like the penicillin, the mechanism of action of the penicillin. That's no need to discuss. If you don't understand, you can watch my previous video, that is where I discuss about the penicillin. Okay, about the bacteria sensitivity. Bacteria sensitivity. Here also the same, like which types of bacteria is the sensitive in the penicillin. The same bacteria will sensitive also in the cephalosporin. So for example, which types of bacteria? It's the streptococci, staphylococci, then gonococci. After that, H. influenza, Haemophilus influenza, then actinomycetes. These are all the gram positive, or we can also say that the first generation of the cephalosporin mostly sensitive to the gram positive, means the very highly sensitive to the gram positive and very little against the gram negative. So, and also we can say meningococci. These all are the gram positive. About the gram negative bacteria, some bacteria, for example, Klebsiella pneumonia and Escherichia coli, E. coli. These two bacteria is the sensitive to the cephalosporin, the first generation drug, this drug. But mostly it's highly against in the gram positive bacteria. This is about the gram negative bacteria. And from there we can suspect that what could be the indication. Obviously, if the gram positive is the more highly sensitive to this drug, so obviously indication will be the same. Whatever disease will produce by this bacteria, that is the indication. For example, okay, let's talk about this one. So these are the main sensitive bacteria. If you know about the penicillin indication, penicillin sensitivity, obviously you can also, from there you can also remember that what could be. So indication, what could be the indication? Indication first of all, UTI, urinary tract infection, respiratory tract infection, then, and this drug also is the very mostly if used in the for the prophylaxis, like before surgery and after surgery. Like pre and post operative surgery we can use. Then respiratory tract infection, like it can be pneumonia, endocarditis. From where endocarditis? In the rheumatic fever. As I said that the rheumatic fever, the main causative agent is the beta hemolyticus streptococci, and as we know that the streptococci is the gram positive bacteria, and we also know that this drug is the very sensitive to the gram positive bacteria. So where there can be used even, but most prefer the penicillin, but if maybe penicillin is the allergic or maybe contraindication of the time, we can use this drug. After that, some genital infections, genital infection. After that, blood infection. About the blood infections and some like the ENT infection like otitis media and some other ENT infections we can also prescribe. Then some joint infection. Joint infection. But it's depend upon the persons that this drug is the really, because maybe we have second generation, third generation, fourth generation. So and mostly we use nowadays prefer the third generation. But if the person is the like the effective of this drug, so usually we'll first we'll try to the first generation. After that, these are the main indication we can say. Usually we use before surgery or after surgery. Some UTI infections, respiratory tract infections, pneumonia, endocarditis, renal infection, blood transfusion, and also we can use like the cellulitis also. So these are the main indication. Now let's talk about that the side effects. Side effects. Side effects, first of all, hepato, nephro, then hypersensitivity, hepatotoxicity, nephrotoxicity. These are the, we can say, even all antibiotic, these are the common side effects. And also those person who have epilepsy, those persons suffering from epilepsy or seizure attack, usually we try to avoid the antibiotic, or if we will give, because if they have bacterial infections, obviously we have to give antibacterial drug. So on the time very less dose we have to give. Or maybe some other group of the antibiotic who don't we can say create the problem, or don't will create the seizure attack, those antibiotic use. So in an epilepsy patient, if higher dose we can give, obviously epilepsy attack can be occur. And about the hepatotoxicity, nephrotoxicity, and hypersensitivity, these are the three are the common side effects, even all beta-lactam antibiotic. Along with this problem, diarrhea can be happen. Diarrhea. Why diarrhea? Because of this drug is the inhibit the our normal flora which are present in the GIT tract. Why? Because of our normal flora have also some non-pathological bacteria which are very useful for our human body. They are help to synthesize some vitamins, some proteins, some we can say protective factor. But if inhibited by this drug, so diarrhea can be occur, and this is the name of the antibiotic associated diarrhea. That bacteria is the Clostridium difficile. So diarrhea, why? Because of the inhibition of normal flora. That's why here is the super infection can be developed if you giving a very high dose and very prolonged treatment. From there super infections can be developed. Why? Because of the normal flora. On that time we have to give antifungal drug, because due to the fungus infections can be occur. Along with that, hypersensitivity here is the very important information about the hypersensitivity. Those person who have allergy in the penicillin, because as I said that the main side effect of the penicillin, that is the hypersensitivity. Mostly out of the 10% of the people have hypersensitivity allergy in the penicillin. And as we know also that the penicillin also belong to the beta-lactam antibiotic, and the cephalosporin also belong to the beta-lactam antibiotic. So structurally almost the similar. So cross reactions can be developed. Means if you know that the patients have penicillin allergy reactions, on the time always you can think about that the cephalosporin group also can be or may be the person develop the allergy reaction. That's why on the time, if you have another group of antibiotic, not beta lactam, any antibiotic that the penicillin, cephalosporin, monobactam, and carbapenem, any this out of the four antibiotic will obviously can be do I mean create the hypersensitivity. That's why we have to change some other antibiotic, for example like aminoglycoside, macrolide, and so and so. But if mostly the these types of allergy reactions can be occur, that is the cross allergy. But some of the persons have penicillin allergy reactions, but cephalosporin don't have. On the time, you have to check. So before you giving the therapeutic dose, you have to give the very little dose to check the person have, maybe they have penicillin reaction, but maybe the cephalosporin drug will not create the reactions. So before giving you normal dose, you have to check first of all that the person have or not. For example, cephalexin, the normal dose is the one tablet morning and one tablet evening. But if you do, but you don't know about that allergy will develop or not, and you know that the penicillin have from the penicillin drug the person have allergy. On the time, maybe the half of the tablet, for example this is the one tablet, so you have to break the half of the tablet, or maybe it will do now 4 particle, and one part of the tablet you have to give the patient, and maybe wait 4 hours and 3 hours, depend upon the persons, depend upon the absorption of the drug. And if no any symptom, no any allergic symptom, no any allergic rash, everything is normal, then you can suspect that the person have only the penicillin reactions, no any cephalosporin drug they have reactions. So you can use like that before the giving them normal dose. That is the cross sensitivity. It's a very important information, that if you know that the patients have penicillin uh, reactions, they have hypersensitivity by the penicillin drug, so you can think that no problem, we can give penicillin, we can give cephalosporin. No, it's always wrong. We can say treatment, because the cross sensitivity can be occur, or maybe an anaphylactic shock or some other angio, we can say dangerous reactions can be occur. Maybe some patient can be die. That's a very important thing. Along with these side effects, can be also like bleeding, because of bleeding. But bleeding always occur in those patients who have anemic patient, and those very prolonged using the drug, because this drug is the inhibit the bone marrow functions. That's why bleeding can be occur. Why bleeding? Because of the, and also some other infections can be occur, because neutropenia can be developed. So those patients who was very prolonged uses the antibiotic, those patients have immune system also, we can say it's weak. Thrombocytopenia due to the reason of the bleeding. Thrombocytopenia. So these are the, we can say, main side effects which can be occurred by the cephalosporin, and usually this side effect also can be occurred by the penicillin. So we can say almost the same. Pain, obviously pain can be occur if we give the cephalosporin, but it's depend upon the, if we will not give intramuscular, maybe the angle of the syringe is not good way, so can be lead to pain, and thrombophlebitis can be occur, but it's very usually very rare can be happen. So these are the main side effects. About the contraindication, obviously you can think here who have hepatotoxicity, liver problem, nephrotoxicity, or hypersensitivity, even epilepsy patient. So in this conditions, obviously it's absolutely contraindications can be, because this drug all is metabolized by this way. And hypersensitivity, obviously allergy will also be one of the very dangerous pathology. So obviously we can avoid this drug. We should avoid rather. Okay, so this all information about the first generation. About the cephadroxil, that is the orally. These all drugs are almost the same. This is the parenterally, this is the orally. But about the cephadroxil, one very important thing about the cephadroxil, if you're giving the cephadroxil and those person who have the less than 50 ml the keratin excretion, keratin less than 50 ml in a minute, 50 ml in a minute keratin excretion. So we have to reduce we should reduce. Only this information about the cephadroxil, that is the orally drug of the first generation of the cephalosporin. If those person may be due to any reason, it can be physiological, it can be pathological. If the creatinine level is the less than 50 ml in a minute, on the time we should reduce the dose, or we have to stop the dose. This information only for the cephadroxil, and about the rest of these two drugs, the almost the same. So this all information about the first generation of the cephalosporin. In the next part, we will discuss about the second generation after the third generation, because it will be very good understanding for the even for the us. So hope you will like about the first generation of the cephalosporin. In next part, next time we will discuss about the second generation. So till then, thank you so much.